And good morning. I'm Dr. Deuk. It's Thursday, March 27, 2025. Our patient has pain in his facet joints. Now, why would he have pain in his facet joints? It's the second most common cause of back pain. He's also had a spinal fusion. I did not do his fusion, but his fusion was done a few years ago, and you can see the screws and rods filling his back, and he still has pain, even after the fusion. So we're going to go in there and try to destroy some of the pain nerves to ease his pain. Okay, let's get started. The procedure we're doing is called the Deuk plasma rhizotomy. It's a treatment that we pioneered at Deuk Spine. It's the only permanent rhizotomy RFA procedure in the world. Other doctors perform RFAs that are temporary, and you have to keep coming back, getting treatment over and over again every 3 to 6 months, and they keep making money every time you come back. We don't want our patients coming back if we can avoid it. We want to fix their back so they never come back again. And that's what we plan on doing, is we perform a procedure where we actually destroy the pain nerve permanently. So let's get started. Henry, why don't you show the audience why facet joints cause pain and how we treat it?
Of course.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
I think it's probably 04. All right, welcome back. Yeah. We're identifying on X-ray our targets for the pain nerves, and they are defined by bony landmarks made of bone. And that's why we use an X-ray, folks. All doctors that target these nerves use an X-ray. It is to target the nerves where they are running around bones. All right, that's good. Let's try that. Shot. All right, I'm going to get started. And let me see. Have to find the optimal entry point. The entry point where we're going to get the best results from. I think it's going to be right around shot. Right around shot here. All right, go ahead. We're going to make our incision here and go in with our probe called the Deuk plasma wand and basically destroy some pain nerves. Any questions from our audience?
At this moment, no current questions.
Shot. Make sure my hand doesn't get irradiated. Shot. Uh-huh. All right. Shot. All right, we're getting close to where we need to be for our first burn. A lot of scar tissue there I could feel. We're going to go for our second burn. A tremendous amount of scar tissue from his prior fusion shot. It's making it extremely difficult for me to get down there, but we're going to get down there, don't worry. Shot. That's looking pretty good. I can feel the screw. I can feel the transverse process where I'm supposed to be. I'm right in the valley between. That actually went better than I expected. And then let's get the bottom one. No. Shot. Yeah, too medial. I have to reposition. Now, what blocks you here is another bone that's called the ischial bone, iliac. Shot. And shot. If you have questions, feel free to ask. In the meantime, since we're talking about back pain, by the way, you see all the screws and rods, right? I am 100% against these screws and rod surgeries at this point. There are very few times patients need it, but most of the surgeons out there are still putting screws and rods in because they don't know how to do less invasive treatment like the endoscopic Deuk laser disc repair, which is a much better surgery. Let's show the audience the endoscopic Deuk laser disc repair, which is a better alternative than fusions.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, did you show the audience how discs should be treated when they're painful? Not with fusion.
Of
Not
course.
anymore. But we recommend laser surgery. It's a much better option. You can see from the surgery there. Do you have the comparison video between laser, DLDR, and fusion?
I do, but last time that we did that, we get age restricted.
Oh, right.
Yeah.
Yeah, YouTube doesn't like it when we show such gory things.
I know.
All right, we're done on this side. We're going to move to his right side. We've just completed the left. Any questions?
Yes, we have a question coming from Jack on YouTube
Hi, Jack. Welcome.
saying, "Hi, Dr. Deuk. Do you zap the facet nerves always at the same relative location of the nerve? And what is the anatomical name of the nerve being destroyed?"
That's a great question, Jack. So, to answer your question, the facet joints in your spine, you have facets in the neck, cervical spine, you have facets in the thoracic, and you have facets in the lumbar. And then the SI joint is one giant fused facet. If you think about it, the sacrum is 5 bones fused together. So the sacroiliac joint between the sacrum and the hip is literally 5 joints, and so 5 nerves. And when we do the sacroiliac joint, it's like doing one giant facet that has 5 nerves, okay? So the answer is yes. The nerves in the lower back are always in the same place. They are running across the superior border, the transverse process, right where the transverse process shot connects to the superior articular process, which is the little joint pointing up. All right, Jordan, what you're showing me here is I'm too medial, right? Can you center us up? I need to see that TP over there, 5 and 4. Now, the name of those nerves, no, you got to bring it to you, man. You keep coming to me. I don't know why you're coming to me. We got to go to you. We've already done my side. More to you, more to you. You're not moving it. Are you rotating or are you sliding? You need to slide to you. Okay? Keep going, keep going. There you go. Shot. Now rotate back so we can see where the TP meets the superior process. All right. I guess we overslid. Come back a little bit or open your window a little, whatever you want to do. Now the name of the nerve is called the medial branch of the dorsal ramus. Medial branch of the dorsal ramus. All right, try to show me where the TP meets the pedicle and facet. That's a little bit better actually. I could live with that. Yeah, I can live with that. All right, so it's really weird because he's got a big broad back. He's a big guy, no doubt about it. Sean? Let me think. That's probably going to be right there is going to be our best spot. All right, so medial branch of the dorsal ramus. That's the name of this pain nerve. It goes to the facet joint. It's the same name in the cervical, thoracic, lumbar. It is not the same as in the sacrum, though. It's the different name in the sacrum. So, but otherwise, it's the same nerve. There's there's two nerves to each joint, but one nerve at each transverse process, superior facet. I hope that answers your question. Any other questions?
At this moment, no current questions.
All right, let's show the audience, because we're talking about back pain, they can see the fusion that this patient had. Let's show the audience the 30 different causes of back pain, because there are 30 different causes. I'm Dr. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. Fantastic. So, thank you, Henry.
Of course.
We've now had an opportunity to see what are the most common causes of lower back pain. And there are 4 things that cause 99% of chronic lower back pain. 4 things: disc, facet, sacroiliac joint, piriformis muscle. Now, this patient, as you could see, had a massive fusion. I did not do it. I never would have recommended that for his pain. I would have fixed it with laser and plasma. But it's too late. He came to me after the fusion, so we have to deal with it. Now, he had pain down at the bottom of the spine. I felt it was coming from the facet joints at 4551 based on his exam. And if you're not sure where pain's coming from, you can always do a block with your pain management doctor. Typically, the pain management doctors, if they do it right, can get good information about the source of back pain by using what are called blocks, where they inject using X-ray machines specific joints or areas in the back that they use lidocaine and marcaine, 2 nerve blocking agents. They block the transmission of nerve signals along sensory nerves. So that's how we actually learned to do rhizotomy, was because doctors figured out they could inject this this chemical into around your nerves that would stop the nerves from transmitting signals temporarily. And these were natural toxins in nature. And these toxins were used by the early doctors to block pain signals by injecting around the nerves. And those toxins would block the nerve signals. And basically what they do is they block the transmission of nerve signals by blocking what's called the axon potential, which is the movement of ions, sodium, potassium, calcium, and chlorine. There are these little channels in the sides of the cells of the nerves that what are called depolarize, where they open up and they let a flood of ions in. So these drugs block those nerves, they block the ion channels, therefore block the transmission of signals. And the early doctors figured out, well, if we can block the pain from that painful joint using a chemical, by blocking the nerve temporarily, why not go and cut the pain nerve and get rid of the pain permanently? So that's how radiofrequency ablation was started. But the problem with RFA, it's a pain management procedure, and pain management doctors, they're not surgeons. They're not supposed to be surgeons. So the original treatment was stick a needle down there, which they're allowed to do, and target that area where the pain nerve is. And this guy had this, by the way. And the pain nerve runs literally. You have my paper clip? Thank you. You're the best, Henry. Of course. The pain nerve runs, we got a question about it. It comes out of the neuroforamen off the nerve root and off the back of the nerve root. It runs right up here where the transverse process, this is the transverse process, meets with the superior articular process, that's the superior facet. And if you're looking at a posterior anterior x-ray, you're going to see the pedicle, which is this bone. It's a big circle. So you want to target the top border of the transverse process right here. And so the early pain management doctors, can you see this, Henry?
Yes, we can.
They stuck the needle right here and they burned. The problem is it doesn't cut the nerve. So what I developed was the Deuk plasma rhizotomy, a procedure, and it's patented now, where you actually slice in here and cut the damn pain nerve. It works, and it keeps the nerve from coming back. So it's a permanent pain relief, but it's only available here at Deuk Spine. And that's what we did for this gentleman. Hopefully it works for him. Hard to say. There's so much scar tissue down there from his fusion that, and the fusion also distorted the anatomy of the transverse process, because the surgeons lay bone across the transverse processes as part of the fusion. They literally lay bone right here. So we'll see. We'll see how he does. I hope we got it. We'll see. I feel pretty good about it, but we'll see. Only time will tell. All right, what questions can we answer?
I have a question coming from Jack once more on YouTube, asking, Doctor, is zapping of the pain nerve is akin to what the dentists do when they perform a root canal? I mean, like when they kill the nerves in one's tooth.
Well, Jack, it's a great question. I don't know what dentists do for root canals. I don't know. I can't answer that question. I don't have enough information about root canals to know that. All I know is that we're with the Deuk plasma rhizotomy, and only with our procedure are we actually permanently cutting and getting rid of that pain nerve. All these RFA procedures are temporary. My prediction is that the future RFAs will disappear. They will be completely replaced with the Deuk plasma rhizotomy all around the world, and that will treat the second most common cause of back pain. Any other questions?
That is it.
All right, thanks for joining us. And remember, you want the best care available in the world, you come to Deuk Spine Institute. That's where you'll get it. We have the best staff, the best doctors, the best equipment, and most importantly, we have the best techniques right here at Deuk Spine Institute. You won't find it anywhere else. Thanks for joining us. We'll be back shortly. We're going to do a patient from New Jersey who's here because he has piriformis muscle pain and sacroiliac joint pain. Now, this is his third visit to Deuk Spine for surgery, because the first time he came, we diagnosed him with all these problems. He had about 6 of them, but he said, I only want to fix one of them at a time. So the first time he came, we fixed the disc. The second time he came, we fixed some facet joints. And then now he's back for the third time, and we're fixing his SI and piriformis. So he's a bit unique in that he's broken up his treatment with us into 3 different surgeries, and he still has one more disc to come back and fix. And so he'll be coming back for 4 visits, but he's doing it that way for his own reasons, and he wants to do it that way, and we're accommodating.